All right, thanks, Sam. The ongoing stress, fear, and anxiety created by the pandemic has weighed heavily on teens and children. And now, as we experience a COVID-19 surge, more children are once again left uncertain about many daily activities. Here to talk about kids' mental health wellness is Dr. Laura Saunders, a psychologist with the Institute of Living at Hartford HealthCare. Doctor, welcome back.
Hello, Lisa. How are you?
We're doing okay. You know, how has the pandemic impacted the role of school and extracurricular activities, which are safety nets for kids?
So I really worry about our young people. And while I think schools and towns are doing the best they can to keep things moving, I think young people and adults as well are in this state of constant fear that things could get shut down, right? We're going on 2 years of this, and that's an ongoing worry. You know, I think the two major things for our young people and adults as well is fatigue and frustration, right? Emotional fatigue about how long this is going on and all the changes that happen on a regular basis, as well as frustration that we just can't seem to get ahead of this. Now we're in another surge. And with cold temps, it just keeps people inside. So there's a lot to be concerned about with our young people.
All right. What are some signs and symptoms that kids and teens are struggling with their mental health?
The biggest concern that I have is isolation, social isolation. And again, really cold temps, schools going online, if that's what they're doing, or going remote, makes kids more isolated. So I worry a lot about isolation. I think people just tend to isolate more in this time of year anyway because it's cold and it gets dark early. So let's look to reduce isolation, get outside when you can, and for the most part, keep an eye on your kids. Parents know their kids. If your child looks like they're struggling, or if they're not doing things that they typically like to do, speak up and say something.
All right. Are there techniques for young adults to manage their anxiety and uneasiness?
Again, I just don't want people to become more isolated. Social isolation is gasoline on the fire of depression. So we need our young people to get out. We need them to do things. We need them to be active. We need them to connect to other people. I don't necessarily want everyone to be on video games or on screens, but finding alternate ways to connect, because COVID spread is also an issue that we need to be aware of as well.
All right. And final question, how can parents help their children cope emotionally during this pandemic?
Well, the first thing I think it's important for parents to remember is that for them not to take their own anxieties and worries and project it onto their children. That's step one. So adults need to kind of manage their own anxieties, not put it onto their kids, but also to bring up to their kids, it looks like you haven't left your room all day, or you haven't, been eating today, or I've noticed you haven't been sleeping. So to bring up changes that you notice, see if it opens up a dialogue. It's harder with teens because they don't talk as much, but do what you can to show what you observe without judgment, what you observe, and offer opportunities. Hey, is there anything I can do to help you?
All right, Dr. Laura Saunders, thank you once again.
Take care, Lisa.
Thank you.